Okay, so hi everyone. My name is Anubhav. I work at Keka, and today we have with us Abhishek Poddar. He's the founder at Plum. We're going to come back to that, but we're going to talk about our topic first, which is the importance or role of group insurance in employee well-being. And first, I'll talk about Abhishek a bit, and then I'm going to give him a chance. Okay, so Abhishek has done a lot of things, I think, before Plum as well. He's been to the IITs, he's worked in the United States, worked at Google, and came back to India to start his own venture, which is Plum. So Abhishek, would you like to tell us something about Plum?
Hey,
It
thank you
sounds
so
like a
much, Anubhav.
fruit, but what is Plum about?
Hey, thank you so much, Anubhav. Hey, everyone. Really good to have everyone here. Yeah, we started Plum almost a year ago. With Plum, we are changing how corporate health insurance works in India. If you look at India, we have more than 1 million corporates, but less than 10% of these companies actually provide health insurance to their employees right now. And many of these Indian businesses actually find the insurance purchase process to be really tedious, really opaque, and costly. We have seen organizations taking even months to set up a very simple corporate health insurance program. So we started Plum to make the corporate health insurance or the employee health insurance more accessible, more affordable, for especially for the businesses of small sizes. Think of companies of 5 employees, 10 employees, 100 employees. How can these small organizations or the SMEs can start providing a really affordable health insurance for them, and a health insurance that the employees and their family members can actually use. It's not something that should just be there as a benefit that no one understands, but actually can go and use it. So that's a quick summary of why we started Plum, and we are hoping that we can make an impact in the lives of hundreds of millions of people in India who do not have health insurance. Health insurance penetration in India is actually very, very low. So we are hoping to make that impact while building Plum.
So I have a lot of questions, but what we are going to do is we're just going to take like 2 or 3 minutes for more people to join, and then we're going to start with the questions. So the people who are already there, if you have any questions, just type them in the comments, and whenever we get time in between, I'm going to take those questions randomly. So you can spend the next 2 3 minutes writing your questions, guys, and we're going to spend our time waiting. Basically, hopefully more people can join us, and then we'll just start. So I'm going to just call out some names in between the people who have joined. So we have Abhishek, we have Anubhav, who's me, we have Anisha, we have Akshat, uh, we have Jyoti, we have Karan, we have Manisha, we have Preeti, we have Riya, we have Santosh, we have Taru, we have Thomas, and people are joining. We have Vishrut, we have VK, and as I can see from the email IDs, people are from like some big corporates. So, guys, as I said, just spend your next 1 or 2 minutes in writing down your questions if you have. I'm going to take them during the session, and we're just going to be spending the next 2 minutes in waiting out for more people to join. Just don't run away because we're going to start. Don't worry. Okay, I'm just going to write that in the comments. So yeah, I don't see any people increasing. We're going to wait for another 1 minute. I think that would be good. Okay, I think we can start, Abhishek, right?
Yeah, let's start.
Okay, so talking about employee well-being, because we okay, so there's a question. Do you want to start with that first? Let's just okay. So before I start, I think I'm going to take the question. So we have Ria with us, and she has a question like, please share a few good options for parental insurance, as they must not burden the company. That's what she's talking about.
Yeah, I think, Ria, if you can wait for some time, I wanted to talk a bit more about group insurance and individual insurance. And in that spectrum of topic, I can talk about what's the difference of taking parental insurance on their own rather than burdening the company. I'll share some options there as well.
So
But
that's
that's a
great.
really good question, Ria.
Yeah, so we're going to take that question, like as you said, like during some of the things you're going to talk about later on. So the first question is, we talk about well-being a lot, especially after COVID happened, and organizations are like we want to take care of our employees and their well-being. And do you think it has an impact on the employees overall? And the impact on employees, do you think that has an impact on the overall performance or whatever the organization is doing, whatever their mission is? So that's the first question.
Yeah, it does a lot. I would say there are three categories of impact. Number one, which is probably the most important, is you should think about, hey, what is the kind of culture that you're building at an organization? Are you a team? Are you a company that really want to care about your employees? And when I say care, truly care about the well-being of the employees, right? And by having a well-being program, by having an insurance program, that's one ways to demonstrate that, hey, we want to take care of each one of you no matter what happens, right? And taking care also includes taking care of your health, taking care of your financial emergencies, and insurance is one part of that, right? So so that's one of the most important aspects, which is demonstrating the kind of culture that you want to build in a very meaningful way. Uh, Number two, I would say it has direct correlation on the productivity of the employees. When you build a well-being program, and we'll talk more about what are the things that constitute a well-being program, right? But think of health checkups, think of OPD, access to OPD, think of access to mental wellness, right? Or EAP sessions. When you do that, your employees can actually reach out to or get access to the right kind of healthcare if and when they need it, so that they don't have to prolong any kind of disease that they may have. And that kind of access actually has direct impact on the productivity, because your employees tend to get well soon, number one, if they have any disease. Or number two, they can actually prevent it as well, right? And you should, when you think of well-being, you should not think of well-being just as an insurance, because insurance is comes into play when someone is already in the hospital. But you have to think of well-being even from a preventive side, which is how do you actually make your employees healthy and not even they shouldn't even land in the hospital, right? So it has direct impact on the productivity. And third is it has direct impact on the satisfaction on the employees as well, because when they see that the company is giving them certain kinds of benefits that other companies don't give, they know that they are being cared about, and they think highly about the companies, right? And we have seen direct correlation between companies that build a really good wellness program and having a good retention, plus also being able to attract really good employees. And if you see all the companies that have done well, right, in the last 10, 20 years, we obviously think of companies like Google whenever it comes to these benefit programs. But one of the reasons companies like Google has worked out really well is because these were some of the core tenets of the company, which is, hey, we will take care of the employees through the right kind of well-being programs.
So that's one of the most important things, that one, you really have to be proactive with the fact that don't wait for your employees to land in the hospital, right? Make sure that you do as much you can as an organization to keep them away from the hospital. But then there's a fact that some of the things you can't really control, and your employees are going to be in the hospital. I think the worst case scenario there is that the employees are going to be more sick after seeing the huge bill instead of the actual disease. We'll come back to that later. So COVID-19 has actually led to a situation where a lot of people are going to the hospital, and So how do you suggest that companies go about proactively, taking a group insurance approach?
Yeah, I think uh, when you think about group insurance, right, think about what kind of uh, team you have, right? And I would say there are multiple tenets of the group insurance that you need to think about when you're building it. Let me actually show a couple of slides as well as I talk through it, because I share this with a lot of people that
Yes.
this is one of the this is one of the most complicated things actually, and I'm glad Anubhav you asked, which is this is one of the most complicated things. I mean, insurance in general is one of the most complicated areas, especially in India, because there is so much of legalese that goes into the insurance policy document. Is like a 30-page document which no one understands unless till the time they actually land in the hospital. And when they land in the hospital is when they figure out, okay, most of the things that I expected to be covered is not covered, right? So
It's not working.
insurance is one of the most complicated things. So let me actually show a couple of slides as I talk about it. So what I recommend everyone when thinking about a company health insurance is there are four major things that you need to decide. Number one is family coverage, who you want to cover. Number two is sum insured. Number three is maternity as a benefit. And number four
Just
is...
1 minute, Abhishek. Sorry to cut you off, but I cannot see. You said you're going to share something, so I cannot see that
Oh,
on the
one
screen.
second. Oh,
Yeah.
one second.
So it would be great if just people can see it.
Can you guys see? Can you see my screen now?
Yes, we can see your screen now.
Got it. So number four is the pre-existing diseases coverage, which we call as PED in shorthand. So these are four things. I mean, there are obviously 30 other things that you can think about when taking or when building a group health insurance program. But if you have to ask me four major things to think about, these are the four things, right? So when you think about family coverage, typically you would have three kinds of plans that you can choose between. One is do you want to just cover your employees? So it's called an employee only plan. Second is employee spouse child, which is ESC plan, where you can cover all the spouses and up to 4 dependent children. And the third is employee spouse child and parents plan, ESCP plan, where in addition to ESC, you can cover 2 parents. This is one of the most important decisions that you need to take. And typically what I recommend is think about what your employees really need, right? Talk to your employees when you are building this plan for the first time on what kind of insurance they want. Do they really care about the parental plan or not? Let's say if you have a very, very young team, let's say most of your team members are 25-year-old, right? In which case the parents will be 45, 50 years old. So very high chance that the parents are also working and they will have their own corporate health insurance. So your team probably doesn't need a corporate health insurance program for the parents, in which case you can actually avoid the parental insurance. Vice versa, if you have a team which is mostly in the 35, 40-year age bracket, you will have a lot of parents who are actually retired and need a parental coverage. So that's just giving you some examples of when you may need a parental plan versus not a parental plan, right? And second is the budget constraint, of course. So to give you a rough idea, if let's say if an employee only plan will cost you 1 lakh rupees for your team, if you actually change it to a employee spouse child parental plan, it will easily cost you 4 to 5 lakhs rupees. So it has a direct increase of 4x to 5x, because one, you are adding 2x the number of parents, and then all the parents are in the higher age bracket where the premiums are also higher, right? So budget is a huge thing to think about when you're thinking about the family coverage. And just to give you an idea of what companies in India do, despite the high budget, we have seen still a majority of the companies take the employee spouse child parental plan or the employee spouse child plan. Very, very few companies actually take the employee only plan. So that's number one area that you need to think about, which is what kind of coverage that you want. Number two is you have to think about what kind of sum insured you want. So what is sum insured? Sum insured is the total amount that an employee or their family member can get covered for when they get hospitalized, right? And typically this can be as low as 50,000 rupees. You can go as high as 10 lakhs. You can sometimes even go higher than 10 lakhs if you really want. And you can actually choose to have it as a fixed one, which is all employees have, let's say, a 3 lakh kind of cover, or you can make it graded, saying, hey, the junior employees get a 3 lakh and the senior employees get a 5 lakh cover. So that's completely up to you. Again, how do you think about what kind of coverage you want? One is think about what is the family plan that you've chosen, right? So if you have chosen an employee-only plan, you can actually take a very low sum insured of, let's say, 3 lakhs. And that should be enough because you won't have critical illnesses of the employees in this young age band. But if you've taken a parental plan, for example, these parents typically can have critical illness, can have heart surgeries, for example, where the hospital cost can be really high. So we would definitely recommend going for a 5 lakh or above kind of sum insured if you're taking a parental plan. And second is, who are the employees, right? Because think of, again, if you have software engineers working for you and all your employees are software engineers living in Bangalore, they would all go to a Fortis or a Medanta
Yes.
of the world, right? Where the hospital cost would typically be a 10,000 rupees per day kind of cost, which means if they get hospitalized for 10 days, you are easily seeing a 1 lakh plus kind of bill.
Yes, 1
So
lakh.
if those are the employees that you have, then you have to take a higher coverage compared to, let's say, if you have mostly blue-collar employees. These blue-collar employees will hesitate to go to a Fortis or a Medanta. They would typically be more comfortable going either to a government hospital or to some smaller clinic or a tier 2 hospital where the hospital cost will be 1,000 rupees per day. In which case you can actually take a very low sum insured plan. It could be a 50,000 rupees or a 1 lakh kind of sum insured plan. So it actually depends a lot on who you are taking it for. And we have seen a direct correlation with the salary as well, because people with higher salary, they generally want a higher or a more expensive hospital compared to people with lower salary who want to go to a cheaper hospital.
So I have two questions. I actually had one of my own questions, and one of the questions is from the comments actually, and I'm going to combine those two questions. So you talked about seeing your circumstances, what kind of employees you have, their age, and so many other factors. Then there's also a factor of needing immediate insurance because people want to insure their employees against corona. So is there a specific policy against corona? And that's the first question. The second question is, one of our viewers has actually asked. I'm just going to read out the question. Yes. So we are planning to start working from office somewhere in Jan. So they're just looking at starting out next month, going back to office. But before that, I would like to gain some ideas for group insurance for employees covering COVID-19. So she's actually, her problem is I want to cover my employees for COVID-19. Other things we'll take care of them later on. So can you talk about
Yeah,
it?
I think both are very similar questions. So definitely. So I think two things. One is you should remember that all the group health insurance plans that you ever take, even if you take it from Plum or you take it from anywhere else, all the group insurance plans will always cover COVID-19. So just be rest assured that if you already have an insurance plan, or if you take an insurance plan in the future, it will always cover COVID-19. Your COVID-19 cannot be denied by any insurance company in India. Number two is if you are now going and building a health insurance plan from scratch. And this was one of the questions, which is you're starting in January, you're starting the office in January and you want to set up a plan. You have two options. One is you can, of course, take a comprehensive plan which will take care of COVID-19, or you can actually take a COVID-19 only insurance, which will actually be more affordable, which can actually be almost 30% of the comprehensive plan. So let's say a comprehensive plan, if that costs you 1,000 rupees per person per year, a COVID-19 insurance plan will cost you 300 rupees per person per year. So you can actually save a lot of cost. It will cover COVID-19 treatments only, and it's a good starting point for your team of or for your employees who are just starting up. And let's say if you don't have a budget to take on the full comprehensive plan.
So there's a follow-up question actually someone has asked, and I think it's a pretty good question. And it's a question from Abhijit, and he's asked, recently hospitals have started putting a cap on medical insurance and Corona Kavach policy, which is, you talked about a specific insurance only for COVID, at 10K per day, as per regulations released by government, but the hospitals continue to overcharge. So what he's saying is, although the insurance is there, but the hospitals just do whatever they want to. And because the people are ill and they just want to get out of it, probably they're paying. The question is like, does it still make sense in taking a COVID coverage of 3 to 5 lakhs when hospitals are keeping per day capping and just doing whatever they want to?
Yeah, no, that's a really good question, Abhijit, and that's one of the challenges that we are seeing in the healthcare industry overall, which is the hospitals are overcharging, and even if the government is coming and saying that there are cappings, the hospitals are not adhering to those cappings. What we have seen in our experience is if you go and challenge the hospitals on why they're not following the government guidelines, they will go and correct the bill. I think the short answer is we are in this a state of flux where things are changing almost every day. And if you see a very abnormal bill being charged by the hospital, you have to go and challenge the hospital. The insurance will give you out what you deserve, what's there in the policy. And actually, one of the benefit of a group insurance policy is you can take a policy which has no sublimits in terms of, let's say, a per day room rent or a per day ICU. So you can actually take a policy where you can completely remove all of those cappings. But now if the hospitals is just charging obscene amount of money, you'll have to go and challenge that hospital either when you're getting admitted or at the time of discharge.
So this one is actually a very direct question. So obviously Plum has been doing insurance as well. So are you guys getting a lot of claims when it comes to COVID patients? And what is the reimbursements been like? Are people happy with things, or are there a lot of problems like from the hospital side, from probably the patient side, from organizations as well? Like how's the situation been like?
Yeah, no, it's a really good question. We see insurance experience is actually, I would say, bucket them into two segments. One is the group health insurance, and second is the retail health insurance. When it comes to retail health insurance, what is retail health insurance? Let's say you going and buying insurance from Policy Bazaar or from any other place just for your own, for yourself or for your family. The challenge there is when it comes to claims, you are on your own to go and challenge the insurance company or to go and follow up with the insurance company to get your claims done. There we have seen some of these challenges where the claims gets denied or claims takes weeks to months to get processed. The group health insurance actually, and that's one of the things that we are trying to change with Plum as well, is our commitment to our customers, for example, is that, hey, you don't have to spend more than 5 minutes to initiate your claim. You spend 5 minutes, give us the basics of what happened, scan the document and submit it to us, and then we will take care of the rest. We will get your claims done. You go back into taking care of yourself or taking care of your business. And that's how, and that's the reason we are actually building this, I would say, layer between the corporates and the insurance company, where we can actually advocate the employee and the corporates and take care of them. And I think that's actually much needed in this world of insurance, where as an employee, you wouldn't understand or you wouldn't have time to spend on fighting for your claim. That's one part of the answer. The other question, Anubhav, that you asked was, are we seeing a lot of claims? We do actually. So this year has been abnormally, as all of you would expect, abnormally high number of COVID claims. We see claims every day coming for COVID specifically, but the experience has been really, really smooth. One of the things, for example, that we measure is the NPS score of the people who have gone through the claims experience with Plum. And our NPS score is actually at 90, which is probably globally the highest across healthcare or insurance. I've never seen that kind of NPS score. And that's something that really matters to us. But we are seeing abnormally high number of COVID claims this year.
So any other things, HR leader or any leader at any organization who's taking care of the insurance, right, for the employees should keep in mind before buying an insurance? Because I can definitely see like you have some more things to share with us.
Correct. Two more things. So we talked about sum insured, and just to give you an idea on sum insured, most of the organizations take between 3 lakhs to 5 lakh kind of cover. We have seen organizations like, for example, Twilio is a global organization. They took a 10 lakh kind of cover. So you've seen people going beyond that as well. But 3 to 5 lakh is a safe amount, I would say. The third one was maternity. As you would know, let's say if you go and buy a health insurance, maternity as a benefit is never covered in that insurance. But that's one of the advantages of the insurance that we build with Plum, which is you can actually go and add maternity into your insurance. And this is for all the group health insurance programs, right? So think about whether you want to provide maternity as a benefit in your insurance program. And when you're thinking about maternity, think about what is the average age of your employees. Let's say if you have very, very young employees who most of them are unmarried, which means that they are not going to use maternity as a benefit, so you can probably skip it. Also think about what's the maternity benefit that you want to set up. Do you want to set up a low maternity benefit of 25,000 rupees or a high maternity benefit of 75 to 1 lakh rupees? So again, giving you a flavor of what companies do. Very small number of companies actually choose not to have any maternity. Most of the companies take a 50K maternity benefit in India. So I would say if you have to just go with the default, just choose 50,000 as the maternity benefit. And then the fourth one, and this is one of the most important ones, is do you want to cover all the pre-existing diseases? What is the pre-existing diseases? These are, let's say if I have had a heart surgery before taking an insurance, the insurance would either not cover it or cover it after 4 years of continued coverage. That is the industry standard. But what you can do is you can, when you are setting up a group health insurance program, you can ask the insurer to cover pre-existing diseases from day one. Again, it comes with an additional charge, but that's one of the benefits that you can get in a PED coverage. One of the most important things to decide is what's the family coverage that you're taking. So let's say if you are taking cover for parents, this is a no-brainer. You have to go and take a PED coverage because a lot of parents are going to have some or the other pre-existing conditions, and you want to make sure that those pre-existing conditions are covered from day one into your insurance. What do most people do in India? Again, most people actually go with the pre-existing diseases cover in India, and because that's one of the biggest benefit of a group insurance, right? In your individual or retail insurance, one of the biggest downside is you do not get coverage for pre-existing diseases, and hence people prefer to have a corporate insurance because you can actually walk into the hospital as soon as you join a company, for example.
No, I kind of agree, and with the lifestyle that we have, especially in India, right? We love food and so many stuff. We do have a lot of pre-existing diseases. It's not cool, but yeah, we need to be careful with that. There's a question. I think I'm not sure if it's really linked to the last part you said, but I think it is. So I'm just going to read it out. It's from Vishrut, and he's asking, is sublimits a common aspect of group health insurance? I don't understand what sublimit is, so even I would want to know like what he's actually asking.
No, definitely, Vishnu. So there are two kinds of sublimits that you would generally see in an insurance program. One is there is a room rent sublimit. Think about, and one of the most common sublimit is that your room rent is restricted to 1% of the sum insured. So let's say you have taken a 3 lakh sum insured plan. What that means is you can only go to a hospital where the room rent is less than 1% of the sum insured, which is 3,000 rupees per day. If you take a room rent, which is, let's say, 6,000 rupees per day, which is twice the sublimit, what will happen is your total expenses at the hospital, let's say you overall spend 3 lakhs and you had a 3 lakh sum insured, you will only get paid 50% of that 3 lakhs because you had chosen a room rent that was 2x of the sublimit. So that's one of the biggest reasons why employees and their family members are dissatisfied with the health insurance when they are actually going and using the insurance, because they never knew about this sublimit. And then they walk into the hospital, they choose a room rent or they choose a room without understanding that they had the sublimit. And then when they get discharged is when they see that they think that, hey, I have a coverage of 3 lakhs, right? They see the hospital bill. Okay, it's a 3 lakh bill. The insurer will cover 100% of it. And when they actually get a response from the insurer saying, hey, we will cover only 50% because you had the sublimit, that's when they get really shocked. And that's one of the biggest reasons of dissatisfaction. So that's one kind of sublimit. Other kind of sublimit is more uncommon, I would say. It's called disease-wise sublimit, where you have common list of diseases. Think of cataract, think of knee replacement. So you may have a 3 lakh cover, but the insurer will put sublimits on each of these treatments, saying for a cataract treatment, you cannot spend more than 20,000 rupees. For a knee replacement, you cannot spend more than 80,000 rupees. Again, when you go to a decent hospital, think of going to a Fortis, you will, for a knee replacement, they would easily charge you 1.2, 1.3, 1.4 lakh rupees, right? So again, you would think that, hey, you had a 3 lakh cover, insurance will cover you. And then when it actually comes to discharge, you get surprised that, hey, insurance is only covering 80,000 rupees instead of 1.2 lakh rupees. Again, the advantage of group insurance is you can talk to your insurer saying, hey, I want to get these sublimits removed because I don't want my employees to suffer or get shocked at the time of hospitalization because of these sublimits.
So the next question, like I had the same question and one of the viewers have the same question. So the question is like, let's say there's an early age startup, right? Really few employees, 15, 20, probably 10. And you want to have a good insurance for them. So does group insurance works for really few employees as well, like 5, 10, maybe 15? Or do we have to like wait for more employees to join our organization and then probably buy a good insurance?
No, that's actually one of the challenges that have existed in the industry for a very, very long time. If you go back into the history of when group health insurance started in India, it started around 20 years ago. It started because of the companies like the Infosys of the world, which had 10,000, 100,000 employees. And they said, hey, we will come together and buy a group health insurance program and negotiate really well. How group insurance evolved was that group health insurance remained constrained to these very large organizations. So even right now, if you are a team of 1,000 plus people, you would easily get a really good health insurance program. If you are a team of 100 to 1,000 employees, you will have a hard time, but you will manage to get a good health insurance program if you are if you really persist well, and if you go and network with the insurance companies and demonstrate them that, hey, you are going to grow fast into a 1,000 people company, then they will entertain you and give you a health insurance program. Be ready to spend more than 2 months convincing them about your company and about the kind of insurance program that you need. But if you are less than 100 people, very, very hard to get a really good health insurance program where you can ask them for a comprehensive cover, when you can ask them for a pre-existing diseases cover from day one, where you can ask them for a maternity cover from day one, where you can ask them to remove all the kinds of room rent capping, etc. And that has been one of the challenges because of which these group health insurance programs in India hasn't penetrated into these small-sized organizations. And that's one of the things that we had actually, one of the reasons we started Plum as well was our goal was how do we enable these 5 people, 10 people organization to set up the same high quality or health insurance that a 1,000 people team would get. And almost at the same price, at the same per employee price that a 1,000 people team is paying. So right now, what we are supporting is any teams that are more than 5 people can actually go and set up a group health insurance program through Plum. We are trying to even lower that down. We are trying to decrease it to less than 5 as well, because we are seeing startups in India which are 3 people. I mean, when you start up, right, you are 2 co-founders typically,
Yes.
and then 1 or 2 employee, right? So even those kind of people or those kind of teams want to set up a really high quality health insurance. So we are trying to reduce it below 5 as well, but right now we are supporting 5 or more people teams.
So can we say that Plum's focus is not on the fact that we're going to have a lot of organizations? It's about the fact that no matter what size of organization we have, the experience is going to be the same. Whether it's an organization of, let's say, 10,000, 20,000 people, or it's an organization of 5 people, we want to say, like Plum wants to give them the same experience.
That's correct. That's exactly correct. And see, the most challenging has been for these small and medium-sized organizations. Think of 5 people to 1,000 people. The 1,000 plus people team have been able to get all the attention they want, but the challenge has been on the other side, right? So our focus is how do we get that kind of high quality insurance and a high quality claims experience to these small organizations.
Yeah, you talk about this because there are two questions, and I'm going to read them out. They're probably the most Indian questions. Like you're going to listen. And I'm going to combine those two questions. So Santosh is actually saying there's so many players in the insurance market. So what is Plum doing different? That is the first question. I'm going to combine the second question because it's part of the question. And just give me a second. Yes. The question is, usually brokers have a commission of 7.5% for their services. Like you want to collaborate with someone is going to charge you a commission. You know what that is. So how will partnering with Plum save someone from that? Or like, are those challenges the same with Plum? And yeah, I think two pretty Indian questions, right?
Yeah, definitely. So on the first one, multiple things that we are doing, Santosh. One is we are enabling these high quality insurance for teams as small as 5, right? That's something that has not existed in the Indian market. So let's say you are a 10 people company, you can actually buy a really high quality insurance of 3 lakhs with all the coverages for as low as probably 15-20,000 rupees for the entire team for the entire year, right? Generally in India, if you have to take a group health insurance plan, you would never ever get a health insurance plan for less than 1 lakh rupees. So we are making it accessible and affordable. That's number one. Number two is our focus on the claims experience for the employees, and that has never existed before, which is how do you actually ensure, how do you commit to the employees that, hey, if you have to have a claims experience, you should not spend more than 5 minutes to initiate your claim and then let someone else take care of the claims for you and have that peace of mind, right? Number three is then we are actually building the overall technology product on top of these services. What has happened in the last 20 years is insurance has remained mostly a manual effort where, let's say, if a company buys health insurance, they will get a 20-30 page policy document, and then they circulate that policy document to the employees. And Anubhav, you were talking about your experience with your last company where you didn't have any idea about the insurance and the benefits, right? And that education about insurance is broken. As a company, you spend a decent amount of money on these insurance benefits, but the employees don't understand it. If the employees have the documents with them, it's like a legal document, which is very, very hard to decode, right? So how do you actually simplify? How do you fix that communication? How do you simplify that communication where, let's say, a 20-year-old guy who has never ever, looks like Sanjay, you're not able to hear us?
Yes, I was actually asking him, like, can you hear us now? But he's saying, Sanjay, do you want to check your internet once? Guys, I hope everyone can hear us. Like, if there's an issue, just let us know. Okay, so yes, I think people can hear us. I think Sanjay has an issue with the network. Sanjay, I hope you can fix your network soon. Yes.
Thanks.
Yes,
everyone.
going back. Yes. Thank you.
Yeah,
Thanks, guys.
so education is a critical part, right? Where think of a 20-year-old guy or a girl who has never ever seen insurance can understand insurance in one simple mobile screen, right? What's covered, what's not covered in simple English, rather than going and understanding a policy document, which is like a legal document.
So the second question, the commission part.
Yeah, the commission part. No, so see, insurance prices in India, and that's one of the challenges with the insurance prices in India is there is no concept of MRP when it comes to group health insurance. So for the exact same insurance program, for the exact same benefit, someone can charge you X rupees and someone else can charge you 2X rupees. What we are doing with Plum is we are making pricing completely scientific. We are removing people from the process. So you can actually go to plumhq.com, build your own plan and get a transparent pricing. There is no human involved, and you get a pricing that is directly from the insurer so that we don't come and add margins to it and keep rooms for negotiation. If you get a pricing X, all your colleagues in the industry would get the pricing X rather than who you are and what kind of company you are, right? So that's one of the things that we are bringing, which is in insurance industry, that transparency, especially in the group health insurance. In the retail health insurance, companies like Policy Bazaar has done a really great thing, which is they made pricing transparent for individuals like us to purchase the policy, so everyone gets the same pricing. But Group health insurance had never seen that. And we were seeing companies just overpaying a lot because an agent or a broker would come and quote some pricing from the insurer. So what we are doing is we are getting this pricing directly from the insurer and showing it to you in a completely transparent and a real-time manner. You can actually go and try it out. Right now, it'll take you 60 seconds and you will get a pricing.
Yeah, it's not like there's no special referral link. You just go, everyone is going to see the same price, the same features, the pretty much same. Everything is same, right? The experience, that's what I talked about in the initially as well, right? When it comes to organizations and there are different number of people, the idea is to keep the experience same. I think that's the vibe I'm getting from whatever information you're giving us. Make sure like there's no difference between a company of 10 people and no difference between a company of 10,000 people. We have another question. I'll ask this one first, and then I'll ask one question that I have. So VK is asking, when we get separated from the services of employer group Mediclaim cover, probably I think leaving the company or something like that, can the individual carry over the pre-existing waiver privilege to an individual policy being taken on an exit?
They can, VK. That's a really good question. So let's say you had your company cover for 2 years. And you now move out. You move out to a policy that had, let's say, 3 years of waiting period in that insurance cover. So what will happen is in that individual or that retail policy, you can show that you have already served for 2 years. So now your waiting period, the balance waiting period will only be 1 year. So you can basically adjust that 2 years of continued coverage that you had with the group into your retail cover. So let's say if you had served with the company for 3 years, then you can start your retail health cover with a 0 waiting period.
So coming back to our very first question, which is employee well-being, right? And what is the best employee well-being program you have ever seen at an organization? Like you were like, that is the standard, like that sets the bar. Do you have an example?
Yeah, definitely. I mean, definitely companies like Twilio that I was talking about. I would say think about employee well-being into these two components, right? One is preventive, which is how do I avoid employees to go into the hospital? And then two is if they actually meet with an accident or have some critical illness, they should be taken care of when they are in the hospital, right? So those are the two large buckets. When you think about preventive, I would say think about access to the doctors. So think about an OPD consultation kind of benefit. It could be a teleconsultation benefit. You give access to really high quality doctors to your employees so that they don't delay even a slight symptom that they are seeing, right? A lot of times employees delay that. They think that, hey, this is a regular thing. If it persists for more than 2 weeks, then I'll go and see a doctor. And that is generally those are some of those things that actually result in a critical illness. If you had seen the doctor right when you had a symptom, you wouldn't have persisted with it. You wouldn't have had that illness, right? So think about how you build an OPD program or a teleconsultation program into your benefits. Think about health checkups. Health checkups is one of the most important things. You want to make sure that every employee is actually having at least an annual health checkup to look at the vitals, right? Look at the vitamin levels and look at the other basic signs of how their body is doing, so that they can take some of the right preventive measures at an early age. So think about health checkup. Sorry,
so,
go ahead.
no, I just wanted to add something that you said. You talked about, people actually waiting for 1 or 2 weeks before actually going to the doctor. It's like when it's actually worse, then you're like, I have no option now. I'm going to go now. But I think that's also because of the fact, because like I also work, I'm an employee as well. Before I had more information on insurance, I was always worried that even if I go to a doctor and something major comes out and the bill is like huge, my insurance is not going to cover that. I'll have to pay that. So I just delay and delay and delay until there is no choice, because I always have that feeling in the back of my mind that my insurance is not going to cover it. But now, like I think during the last year or so, I've had better information on insurance. Now I'm more content that, okay, if I have insurance like this, even if something major comes out, I'm going to be covered by that. So I think that communication, establishing that communication between employees and the people at the top in the organization is really important.
Yeah, no, I think that's a really good point. And see, one of the things that we also are trying to solve via Plum, which is how do you how do you ensure that every employee knows about each and every benefit that they have, so that they can actually go and use it efficiently. The other point I would say is also, see, one reason is the financial reason of, hey, I'll have a huge hospital expense and hence I don't want to go and see a doctor. The other is also the time, right? Typically, you have to take off for half a day to walk into the hospital. And I would say, instead of OPD program, which is just including the physical visits, think about teleconsultation. Now you can actually get access to really high quality doctors on the phone, right? So instead of spending half a day taking an appointment, walking into a hospital away from the work, you can spend probably 10 minutes having a quick call with a good doctor and get an early answer into what's happening with you, right? And that 10 minutes anyone can take out, right? So
Yes.
one of the things that we recommend to all of our corporates that we work with is definitely include teleconsultation into your wellness program, because that is going to be much more powerful, much more used by your employees than anything else.
There's a there's a question from one of the viewers, Ria, and she's asking: is there a scheme in the insurance industry to cover POD test? I have no idea what that is. As not always 24-hour admission is recommended. That's what she's asking.
Yeah, so I think what you meant was, so generally the health insurance requires 24-hour hospitalization. There are two kinds of things that you can do in addition to the 24-hour hospitalization. So one is there are daycare treatments. Think of cataract, for example, right? Cataract doesn't require 24-hour hospitalization. So your insurance can actually cover daycare treatments and all kinds of daycare treatments. Number two is the OPD, I think, which is what Ria is asking.
Yeah, she's asking that.
Yeah, so there are two things that you can do within OPD. So one is you can ask your insurer to cover OPD for you up to a certain amount, but just be mindful that if you get your OPD covered through insurance, it will be very, very expensive. We talked about some of the benefits into the insurance program, like maternity, like pre-existing diseases coverage. OPD is the most expensive benefit to be added directly into the insurance programs, and that has been for traditional reasons. So my recommendation is, if you want OPD as a coverage, don't do it with the insurer, do it outside the insurance. So for example, what we do is with Plum, when we build a holistic wellness program, your insurance directly won't cover OPD, but we have a separate OPD product that gets added, where your employees will actually get unlimited teleconsultation followed by a face-to-face consultation for the OPD visits. And that's much more affordable for the organizations. You will actually end up spending almost 1/10 the cost that you would otherwise spend on the insurance if you got OPD as a benefit from the insurance company.
Yes, I think OPD is always confusion in people's head when it comes to insurance. Like, is it going to work? Is it not going to work? So yeah, so I have a question. Like, insurance is a complicated, field in general, especially in India, where things are not clear. As you said, there's so much documentation. So this is a question for you, Abhishek, because you started the company, right? How did you come into insurance? Because you worked in the United States, right? And not in something into insurance. You were at Google doing so many different things, building products. So how come you are like, I'm just going to go back to India and I'm going to build an insurance company?
No, it's very interesting. I think what has happened in the insurance industry is actually no innovation has happened, especially in the health insurance space. No innovation has happened in India in the last 20, 30 years. And one of the core reasons is people from the industry have been trying to go and build new things. But if people from the industry go and build new things, they are already constrained by what they have seen working and not working, right? So if they have seen that, hey, the claims process should typically take 1 month, they wouldn't go and challenge it, right? They would go and say, okay, I'll include, or I will go and improve that 30 days process to a 15 days process. If when I go into the insurance, for me, because I don't know why it should take 30 days, right? So I will go and ask very basic questions that, hey, why can't it be real time? Why can't claims happen or the claims processing happen on the same day as much in real time as possible, right? Because I don't have that preconceived notions that, hey, here are the 10 reasons it should take 30 days. So I go and challenge those assumptions. Same for the, we talked about the size of the group, right? When I started Plum, I was very shocked that, hey, why is group health insurance not available to a 10 people company? Why do we need a minimum of 100 people or 1,000 people, right? So I think that's the big advantage that we got was we can start from a very fresh slate. We can think as everyone here in the audience is thinking about group health insurance, right? Asking very simple, very basic, very intuitive questions that, hey, why can't I get OPD insurance? Why can't I get insurance without any sublimit? Why can't a 5 people company get an insurance? Why can't I get a claims experience which is similar to, let's say, my experience with Amazon, where things get shipped within a day or in 2 days?
You can see all the information ordered, ready to be shipped, delivered. It's so instant, right?
Exactly.
So I think so I have a question from Sony, and she's saying, I think you've already answered that question, but if you can just spend like 10 or 20 seconds again, like what about dependence insurance, such as parents or other people in the family?
Yeah, so you can, when you are building your group health insurance plan, it's a choice that you have as a company, which is you take an employee only plan, you take an employee spouse child plan, or an employee spouse child and parents plan. So you can, of course, cover your dependents, such as parents, in your corporate health insurance program itself. I think one of the previous questions,
Yes.
one of the very first question was around the parental insurance. Sorry, I missed that. So let's say as a company, if you decide not to cover parents, maybe because of the cost, what happens is if you are allowing or if you're asking employees to cover parents on their own, there is this concept of adverse selection that is happening. What that means is only those employees will buy the insurance who think that their parents are going to get hospitalized, let's say for a knee replacement surgery this year, right? So instead of buying insurance for all the 100 parents in my group, I am buying it only for those 5 or 10 parents who are going to use the insurance immediately. By nature of that, you would never be able to get an insurance which can cover pre-existing diseases from day one. There will always be a 4-year waiting period. So of course, you can buy a parental insurance where you ask employees to buy it on their own. You can actually get a discount as well on that. But the biggest challenge is you wouldn't get an insurance plan which can cover pre-existing diseases for your parents if you're not buying it as a group for your entire employees.
Okay, that's great. There's one more last question, and then I'll have one more question, I think, after that. So I don't know if you want to answer this question. So Ria is asking, what's the business model or business profit for Plum and other insurance? I think she's asking in general, like how do you guys make money? And why they want to help people? Like, what's the takeaway in the model? Like, why?
No, definitely. Definitely want to be very transparent. So there are two business models for us, Ria. One is we provide a technology platform to the companies, and we charge a software fee for that platform. Right now, we are charging only for very large companies. We are actually making Plum as a platform free to all the smaller sized companies. Think of 10 employees or 100 employee companies. Number two is we also get some distribution fee from the insurance partners, and it depends on how well the portfolio did for the insurance partner. So it's not a straight away kind of fees. It's think of if someone had paid a premium of 100 rupees, but the claims was pretty low, the insurance company can decide to share some fees with us.
Okay, so Ria has another follow-up question. She's loving it. She's like, will the data be subjected to lead generation if we choose Plum?
Sorry, I didn't get that. What kind of lead generation?
So I think probably she's asking like, so if an organization decides to partner with Plum, right? So there's going to be a lot of data that Plum will have on employees. So is that data used for lead generation
Oh,
by
got
someone
it,
else?
got it. No, so all the data is completely confidential. We have a very strict privacy policy in terms of the data that is submitted, right? I mean, end of the day, we are building a healthcare company here. And in healthcare, you have to be very, very rigid, very strict about how you're storing the data and to ensure that no data is ever leaked out or used in any other way other than ensuring the employees and the family members of the company. So you can, of course, go and read the privacy policy as well, but we are very strict in terms of our guidelines on how we protect the data.
So, yes, and actually, Anisha has written a comment. That was my last question. Let's say I am an organization or probably a leader of the organization right now, any organization, and I want to buy insurance. What do I do? Like, how do I contact you guys?
No, I think the easiest way would be just go to plumhq.com. It will take you 60 seconds to design your health insurance plan. And that's one of the things that we are trying to solve, right? Earlier, what you would have to do is go and find a insurance broker or an insurance agent, give your data of the entire company, and then wait for 1 week to get some plan. And that pricing is opaque. What we are doing is you don't have to wait for weeks. You have to spend 60 seconds and you can go and get a real-time pricing on your own. I'll just type the URL as well if you want. So this is plumhq.com. So try it out. Please give us feedback. If there is any feedback,
So
you can
Abhinav does have a feedback. He's saying I tried error while registration. He's just actually mentioned it. So I think you guys definitely Abhishek. We're going to. I think Abhishek and no. Oh, both are. Oh, Abhinav. Yes. I got confused with the name. Abhinav, I'm pretty sure Abhishek and the team will contact you regarding that. Don't worry. So I think that's all. If anyone has any questions, guys, type it down in the next 30-40 seconds. We're going to take that. And then we are going to wrap up. Okay, so Thomas is asking, do you guys have an app on iOS?
Not yet, Thomas. We are still building it. Right now, our product is available on the mobile web. So on your iPhone, you can still open plumhq.com and access all your benefits. But we are soon going to release on both Android and iOS an app as well.
So I think looks great. Any last tips you have for people before they go on to buy insurance for their organizations?
I would say two things. One is definitely have an overall strategy around why you want to set up an employee wellness program and think about that wellness program in a holistic way. Definitely don't recommend taking shortcuts to it, right? Talk to your employees, understand what they really want, and then decide that health insurance plan or the health benefits plan. Number two is think about the long term when you are thinking about health insurance plan. What I've seen organizations doing is, again, taking shortcuts into over optimizing on the budget that, hey, I'll save 5,000 rupees here or 10,000 rupees here by cutting down on some of the benefits. But then what happens is your employees end up having a really bad experience at the hospital because you ended up saving maybe 1 or 2% into your health insurance plan, and you are spending lakhs of rupees maybe, right? If you are a large organization, you don't your whole expenditure on that health insurance plan goes down the drain if that one employee actually has a really bad experience. So you want to make sure that you don't cut corners when you are thinking about building up your health insurance plans.
Thank you. So yes, that's all. I think we're going to end it now. And I had a good time talking to you. I actually learned a lot of new things because in fact, I even had like a little bit of idea about insurance, especially group insurance. So thanks everyone. And we're going to end it. I'm Anubhav.
Thank you so much for having us here, Anubhav.
And here's Abhishek. Bye guys.